What we're going to do now is I'm going to talk about some of the collaboration that we've all been part of over the past year. A collaboration across social work, Centres for Inclusive Living, disabled people's organisations, independent support organisations, Scottish Government, care provider organisations, and the strategic partners and membership organisations which support people to access personal assistance and support. I came into post during the first few months of the pandemic and stood here 2 years ago having just launched a research report in partnership with the Alliance, My Support, My Choice, based on the experience of people accessing SDS, speaking about the need for a focus on quality. Many of the recommendations from our report, based on what people told us, focused on the critical relationship between social workers and people, on good conversations and a move back to relationship-based practice, as well as the need for training for frontline workers and managers to focus on improving outcomes for people. Concurrently, Social Work Scotland were then developing a suite of standards for good SDS practice, as Councillor Kelly just mentioned, to help us all with understanding what good SDS looks like. That focus on quality and the momentum that collaborative working gathered through the independent review of adult social care results in today's drive for improvement. Initiated by Social Work Scotland, the SDS National Collaboration, with facilitation by SDSS and me chairing, has gathered momentum at an impressive pace since last April, after its first meeting, with cross-sector engagement from a wide range of partners working in SDS implementation, with a direct route to Scottish Government who attend and participate in the group. The first main tangible outcome of this group was the agreement to develop a national SDS improvement plan, facilitated by SDSS for publication by Scottish Government and COSLA. Developing this new policy came close on the heels of the SDS statutory guidance, also revised through a collaborative process, producing a detailed guide for those working with SDS delivery every day. I heard someone say recently that all collaborations are a process of compromise. Individual views are naturally diluted and merge into a collective compromise and a collective agreement. There's been a void and an essential strategic driver since the SDS implementation plan expired, and this plan intends to fill that. We'd hoped to launch that plan today, but the timescale did indeed prove ambitious. And we want to make sure that we get it right. Much has been achieved through working together with the National SDS Collaboration and the working group focused on developing the plan. And Scottish Government and COSLA hope to publish this document shortly. I'd personally like to thank those who gave of their time, experience and their lives in informing the policy. Will you recognise your input in this phase? It remains to be seen, but please understand that we've taken all of it on board and we take none of it lightly. The organisations round the table who work with people directing their support are informed daily by the input that you've given. I'd like to talk a bit about the Personal Assistant Programme Board. Born out of the collaboration necessitated by the pandemic, the PA Programme Board, chaired by Ian Turner from Scottish Government Workforce Division and myself, with an SDSS Secretariat, has gone from strength to strength in the practical achievements it's making to support the development of the PA workforce, with the special interdependent relationship between the employer and the PA at the heart of planning and delivery. The initiative was generated by the Short Life Working Group that was set up to deliver the 500 COVID thank you payment to the PA workforce, which was then unidentified, unquantified, with significant inequities between them and the rest of the social care workforce. One key outcome of the exercise was that the lack of capacity within Centres for Inclusive Living, whose funding has tightened over the years so that they were unable to support a timely process. The funding crisis in the key supporting organisations within the independent living movement remains critical. An extensive work plan and delivery structure has been developed, which now supports workforce development through a range of work streams, including wellbeing, recruitment, information and communications, data, peer support, a national direct payment model, an awareness campaign and training. Some of the initial outputs and successes then. So we've got a funded national training framework for PAs and employers being developed, with core training delivered in partnership with employers. We're due to interview for those 2 project posts very shortly. We've developed a recruitment page on My Job Scotland for personal assistant jobs. There's the Make an Impact online awareness campaign showcasing personal assistants and employers in videos, a series of radio promotions, and our first PA-led version of the PA newsletter, which launches today. We work to explore the PA wellbeing through collaboration with Birmingham University's Improving Adult Care Together Impact programme. There's a funded PhD post at Glasgow University to look at PA-related data. And we've had the delivery of the first annual PA survey, which gave us a wealth of information that supported all of our work streams. And the second iteration of that will be launched at the start of April, and that will help us understand how the PA workforce is developing and help to quantify the workforce. The launch of the online PA employer and PA handbooks over the past year. Now you can find out more about these at the virtual exhibition stand at this event, but they've been widely used by a wide range of people on a daily basis. The programme board got a range of key partners, including the SDS Practice Network, Disclosure Scotland, and we report directly to the Minister, as he said in his address. One of the initial statements endorsed by the programme board and agreed with Scottish Government was that there's no intention to regulate personal assistance. The collective acknowledgement that regulation is an approach that risks undermining this relationship, agency and control of the employer has been well received. As part of my role in representing the board, I sit on the stakeholder engagement panel for the independent review of inspection, scrutiny and regulation. I was pleased that recently when the review took a separate focus on PAs, and I was able to meet the review with representatives from the board to address key concerns and aspiration for the review's PA-related recommendations. So we got all your feedback, thanks for that, and these are to be formalised imminently for consideration so that the review can make hopefully positive recommendations focused on improvement. The SDS standards, if I could turn to those, showcased at our last event and developed in collaboration with many of you. The Social Work Scotland SDS Standards for Good Practice are at a critical and exciting stage in their development as the work progresses with local partnerships to develop self-evaluation tools to implement a standard approach in terms of quality of delivery. We're also working with them to identify a corresponding tool for independent support organisations so that this level of quality translates in a cross-disciplinary manner. This will undoubtedly highlight the need for further development of the standards. Those of you taking part in one of the workshops hosted by Social Work Scotland this afternoon will be able to contribute your views to the planned review of standards. So on to the SDS improvement plan and the process of developing this. In developing our approach to a steering group formed from the national SDS collaboration, considered what had gone before in terms of an implementation plan, the change map and other related policies. We identified a structure from the previous plan with 4 broad outcome areas. Now, the desire was to develop the plan from a bottom-up approach, and we proactively sought to engage across the sector with people who have a stake in SDS improvement, especially people with lived and living experience. Following the consultation period that you all took part in, there was a broad agreement with these headings, but that they should be reversed so that they indicate a reprioritising, so that they now read supported person and carer's choice and control of their support, worker autonomy, skills and practice model, systems and culture, and leadership. Now, here are the areas that received the most proactive support, the areas that you commented on the most. The first one was people have access to good independent support and advice to help them navigate the social care system. Then there was SDS is embedded in social workers' higher education, ongoing training and practice development. Thirdly, there was leaders have strong understanding of SDS principles and values to ensure staff feel supported and encouraged in SDS. Fourthly, supported people and carers are involved in planning social care services. And lastly, the public are better informed about self-directed support and better able to navigate the social care system. You commented on many more, but those were the top 5 that got the most comments. As we work hard to find consensus on the most effective way to deliver on these outcomes, it'd be unfair for me to say at this stage and to guarantee what will be taken forward in the plan. But in terms of our commitment to the people who gave of their time and experience, their consultation responses will continue to inform ongoing development. What needs more discussion right now is the funding and activities that will be attributed to year 1, as well as agreement on prioritisation to ensure that the plan's active, that it's measured on an ongoing basis and that it's relevant to people's lives. One of the things that will be delivered in the coming year is part 2 of a 2-year development project based on community brokerage. We see the need and appetite for community brokerage increasing. So how are we developing this? Initially, we developed a programme plan with a 3-pronged approach. First of those prongs being enhanced delivery of the brokerage SQL approved award. So in the past year, there have been 2 concurrent cohorts delivered, 1 general and 1 to carers organisations. An approved brokers community of practice formed by graduates of the award to ensure ongoing CPD practice development and delivery. And that's been well developed over the past year, and you'll hear Dawn Ransom from the ABC of P talk at one of the workshops this afternoon about brokerage. The last part, which will be our focus for the coming year, is the development of a national brokerage framework. There have been initial meetings with a growing group of around 12 organisations interested in forming a framework. These aren't all brokerage organisations, but some who deliver elements of brokerage and who can improve their delivery by enhancing their offer. So this, as well as ongoing delivery of the first 2 elements, will be the main focus for year 2. Members of the approved brokers community of practice are running a workshop this afternoon, as I've said, and we've also got information in the community brokerage award in the virtual exhibition stands for those who are interested in engaging in that award. We're going to have one of the highest level of inquiries that we get at SDS Scotland is on autism. So we've done some initial work on autism. Lindsay Stewart, who is embedded in autism work, has undertaken a scoping exercise, and a report will be forthcoming. We hope to launch that on World Autism Awareness Day next month. We intend to set up a working group to address the issues raised, so please get in touch if you're interested in this piece of work. Lindsay's going to be facilitating a workshop this afternoon to explore the issues and recommendations. We're going to take a similar approach to other marginalised communities, which will be part of a series of golden threads that are threaded throughout the improvement plan. Communities such as SDS in addictions, for example, set up a working group on that based on a workshop that we held at our AGM with members working in this field and people with lived experience. So if I can reflect on today's theme, harnessing momentum. This comes in the context of some delays we've had to the NCS bill. At our AGM last year, many of you will have heard Anna Kynaston, the Deputy Director for the National Care Service, give a progress update on the National Care Service bill, stating the team's intent to embed human rights and living experience at the heart of the National Care Service. So she said, in the years leading up to the establishment of the National Care Service, we need to make improvements in the way SDS is delivered. She outlined how part of that would be achieved by shifting statutory responsibilities from local authorities to National Care Service local care boards, with social workers continuing to have a key role in assessment and agreeing outcomes for people. She said, because improvement can't wait for the NCS, improving SDS now is part of a wider social care improvement workstream aimed at embedding a person-centred approach, improving the way systems share information, a greater focus on quality of life rather than quality of care, and addressing workforce capacity issues. Anna indicated that one of the actions to improve SDS would be to develop a Scottish Government causal improvement plan for 2023 to 27 to focus on what will make the most difference, including what Scottish Government will fund. She spoke about their approach to co-design, with the inception of a lived experience experts panel being one of the ways by which people with experience could engage in co-design activities. The National Care Service Forum was held in Perth in October last year, and it's intended that that takes place annually to allow stakeholders and ministers to continue the discussion. We're pleased to be joined today by those who facilitate the Lived Experience Expert Panel, Scottish Government's Office of the Chief Designer, alongside colleagues from Inclusion Scotland's People-Led Policy Panel, and a workshop this afternoon to discuss how the approach to co-design has worked in discussions around the NCS and how this can be applied to work to improve self-directed support. We'll be asking, what does meaningful engagement look like? And it's a topic that we'll return to again and again. So how do we collectively keep the momentum going? Does co-design mean co-responsibility? Is it really co-design without it? One of the questions that we hear asked is how we will progress and how will progress and success be monitored, measured and reported? And will people accessing SDS be part of that monitoring and measuring process? In developing the SDS improvement plan, we had a very tight time frame. We engaged with people who access SDS to direct their own personal assistance and support through an online exercise and several roadshows. One of the main things that both concerns me and which I'm continually impressed by is that people keep coming back for another round of consultation, engagement, co-design. When I've asked what people keeps motivated, one of the replies that comes back is fear. Fear that regulation will enter people's homes, or that budget pressures will mean they can no longer be supported in their own homes. That's something that we must bear in mind when we ask people to contribute time and time again. There's been an incredible demonstration of collaboration across the board in the past couple of years. And it'd be wonderful if we could move past this premise to a place based on the reflections set out years ago, where we had a shared understanding of the values and principles of SDS to improve delivery. At our last AGM, we asked how we honour our commitment to the independent living movement and to everyone accessing SDS as a disabled people's organisation. So this afternoon at the workshop I've just mentioned, we'll continue our conversation to see how we improve people's involvement and honour our collective commitment. I hope that you enjoy what promises to be a lively day, given there is a forward focus and helps all of us identify some tangible ways of supporting and keeping the momentum for improving self-directed support delivery.